So one of the ways that home medical equipment supplier, at least for us and our family, has made a huge difference and helped us manage Oliver's conditions is, essentially we're able to keep him in our home, which we would not be able to do if we didn't have all these supplies.
Can't recover at home without medical equipment. So you have to have HME providers to do it, and we're lucky to have our relationship to make sure that happens for our patients.
How can we be a part of the change in this policy?
I think it's, again, lobbying the Hill. I was in DC all of last week, had many productive meetings. It's a good story to tell. The optics don't make sense. A failed bidding program, no price increases in 6 years. I'll take that with a supply chain crisis going on today. Right. We see an increased cost of goods by 30%. Just getting the product, to the country is increased costs, increased delays.
We have seen a drastic increase in the last month of referrals that we would normally have gotten from hospitals upon discharge. We are now seeing those coming from ER and physicians' offices because there's no beds to put these patients in.
If you need an oxygen tank for any portable access or as a backup, then we run into the problem of being able to get replacement tanks. We tried to order some extra cylinders that you see rolling around on a cart, and they're telling us 4 to 6 months.
There's more to do with the rise of kids taking care of parents and grandparents than just baby boomers getting older at faster rates. Yes, that's happening, but so is a workforce shortage in home healthcare workers. People you can hire who are trained and licensed to take care of other people at their home.
There's a couple different components. Number one is reimbursement of home care services is set by Medicare, and reimbursement over the last 10 plus years has gone down at a pretty significant clip. So that's one challenge. The other challenge is there's inflation, there's wage increases, there's increased cost of care because of new technology that's needed. So there are other additional costs involved in providing and delivering home care.
It's really about ensuring access to care for those end users and those with the complex medical needs that benefit from ventilation therapy.
Medical supply companies are just having to say to families like ours, we can't afford to give you your medical food because what we're being reimbursed is only 20 or 30% of the actual cost of that food.
Between inflation, costs of gasoline, staff costs, and then freight costs have really kind of all converged on us at the same time. And then with reimbursement staying the same, we are really having a hard time providing our purpose for our families, which is to provide high quality clinical home care to medically fragile children so they can grow and flourish to their full potential.
In Michigan, 18% of our state's population is now 65 years and older. That's the 14th largest aging demographic in the country, and this group has opinions about aging in place. The vast majority want to stay home for as long as possible. That means they need access to the right resources, everything from medical supplies to caregiver services.
People are waiting a long time to get these particular power chairs.
And repairing them is its own challenge, with many parts on back order due to the global supply chain crisis.
So this is not just about it being their primary form of transportation. This is also about independence.
Independence and being able to do things themselves. Getting one of these chairs could be the difference between them going to a nursing home or staying at home.
Corey's a high-flow patient, meaning he depends heavily on his oxygen daily. He says when there's an issue with his equipment, it's unbearable.
It's to feel so horribly, and yet to have somebody come out here as fast as they do to correct a problem if there is one. I cannot tell you in words how much I appreciate it.
So medical supplies all through here.
Back at the warehouse, CEO and President Cal Tumagen shows how many shelves are sitting only at half capacity. It's the first time in the company's 17-year history that prices have reached record highs. But it's not only just the oxygen tubes that are increasing in price and decreasing in availability.
Everything's more expensive. Everything's delayed in terms of getting here. And patient demand is up.
Cal says the industry sets predetermined prices and don't account for his operating costs, and he fears the lack of affordable and available equipment might put some people back in the hospital rather than in their homes.
Dressen has been in the medical supply industry for 41 years. He opened his family business in 2003.
It's a very rewarding business. We help others is what we do. We help others recover from injuries and illnesses and make them feel better. So I've always been able to make a phone call and get it in a short amount of time and never have had to plan out weeks and months ahead of time to get the supplies.
And while some items are back in stock, the shortage of parts is making it impossible for Dressen to fix his patients' equipment or fulfill new requests.
These scooters provide mobility for patients. It's one of the vital parts of people keeping their independence.
Before Hurricane Ida made landfall, Jones Medical Supply sprung into action, making sure all of their at-risk patients were taken care of.
All oxygen equipment is powered by electricity, and then they have backup tanks. And so we call those patients, check on supplies of what they have, and then restock them in time before the hurricane comes.
The company delivered oxygen tanks all the way up to the point when emergency weather officials advised people to stay home. Then they made more deliveries to patients without power as soon as it was safe to get back out.